Right, welcome everyone. Thanks for taking time out your evening to join us for what I hope will be a really useful webinar with some practical advice for managing reflux. For those of you who don't know me, I'm Jordan. I'm a physiologist at the Functional Gut Clinic. You might know me as MrGutHealth on social media. And I'm joined by the amazing Dr. Rabia, who is a consultant gastroenterologist specializing in neurogastroenterology, which is basically the gut-brain connection. And what we're going to do is split our talk. So I'm going to start by delving into the causes, tests, and treatments for reflux. And then Rabia is going to spend some time showing us some practical, holistic techniques to manage it. So it's going to be really useful, but try and stick around till the end if you can, because we'll do a live Q&A where we'll answer some of your burning questions related to reflux, pun intended. So without further ado, we'll get started. Just sit back and relax and enjoy, because we are recording this and we'll send you all the recording in a couple of days. So I love doing a talk on reflux because I get to show this. It's a superhero from the Incredibles 2, and his superpower is basically hot lava that he regurgitates. But for the rest of us, acid reflux is definitely not a superpower. But it's important to point out that all of us get reflux, but not everyone has gastroesophageal reflux disease. And the gastroesophageal reflux disease, or GERD, is defined by having symptoms that affect your quality of life, as well as complications of reflux like inflammation. And the percentage of population in the UK that have GERD is around 14%, so 1 in 8 of us. And the symptoms of GERD can be esophageal, or what we call classic, the more obvious symptoms like heartburn, chest pain, regurgitation, bringing acid and food back up. Or they could be extraesophageal, or what's known as LPR symptoms that affect the throat, the mouth and the airways, things like cough, sore throat and globus, this sensation of a lump in the back of the throat. And what causes reflux? Well, I want to bring your attention to 2 muscles that basically separate the esophagus, the food pipe, and the stomach. And that is the lower esophageal sphincter valve and the diaphragm. And probably the main cause of reflux for most people is a weak lower esophageal sphincter or a weak diaphragm. And because these muscles overlap to form a valve, if they separate because they're weak and some of the stomach comes up into the chest, this is when we get a hiatus hernia, which is also a common cause of reflux. There are some things that also trigger reflux as well. Being older, and that's because as we age, these muscles we get weaker, and things like a hiatus hernia is more likely to occur. Being obese or overweight, because that increased pressure from the abdomen on the stomach can force reflux to come up. In a similar way, being pregnant, when that baby puts pressure on the stomach and the valve. Fizzy drinks cause reflux because every time you belch, you bring reflux up. Chocolate can also cause reflux. It's been shown to weaken that lower esophageal sphincter muscle. Acidic or spicy foods don't actually cause reflux, but they make your esophagus more sensitive. So these are a typical thing that people with reflux will avoid. Alcohol has been shown to also weaken that lower esophageal sphincter valve. And then NSAIDs, medications like aspirin, actually prevent the production of something called prostaglandins, which normally help our esophagus to produce mucus that protects us from acid reflux. So these can make, even though they are anti-inflammatory, they can predispose you to inflammation from acid. And lastly, smoking, again, has been shown to weaken that lower esophageal sphincter valve. There are some other causes of reflux that are less well known. One of those is gastroparesis, which basically translates to paralyzed stomach. And this is where food sits in the stomach for long periods, meaning reflux is more likely to occur. And this can happen if there's a problem with the valve at the end of the stomach, because the stomach has 2 valves, the one at the top and the one at the bottom. And also if there's some damage to the nerve that supplies the stomach, the vagus nerve in particular. Reflux can also be caused by something called Zollinger-Ellison syndrome, which is essentially where you produce too much acid or too much of the hormone that signals the release of acid. And what about low stomach acid? I'm sure you've probably seen on social media someone say the main cause of acid reflux is low stomach acid. That doesn't really make sense to me, because if you're on a medication that lowers stomach acid, it helps your acid reflux. And in my professional opinion, from measuring thousands of people's stomach acid levels, low stomach acid is rare, but it can cause reflux, not in the way that you expect. It might cause reflux because of its effects on the gut microbiota or gut bacteria. So if you have low stomach acid, then you don't have that barrier, that disinfectant that blocks or kills bacteria that you swallow. This means those bacteria are more likely to make their way into your intestines and survive or overgrow. And we know that the longer you're on PPI medications, which lower your stomach acid, the more likely you are to have this overgrowth of bacteria. And increased bacteria in your intestine, what they then do is they ferment carbohydrates, which produces excess gas, and this gas causes reflux. And research from our clinic that we published has shown that people who have this overgrowth of bacteria are more likely to have reflux that doesn't respond to medications. In fact, these medications might be making reflux worse by causing a significant imbalance in the gut bacteria, in the gut microbiota. When should you see a doctor about reflux? If you've tried medications, if you've tried lifestyle changes and they haven't helped, if you have symptoms most days, if you have difficulty swallowing or you're choking on food, if you find yourself vomiting frequently, if you have unexplained weight loss, so you haven't been trying to lose weight, but you've noticed that you have, if you have some unusual symptoms like fatigue or night sweats, and if you have a family history of acid reflux or even esophageal cancer, then you should go and see your doctor. And that's because if reflux is left unchecked, it can lead to quite serious complications. The first stage is esophagitis or inflammation, where the acid has damaged tissue in the esophagus. But when that tissue is damaged over years, that tissue can then change into something called Barrett's. And this is that salmon pink tissue you see in the picture. And what's happened here is the cells in the esophagus have changed into cells that more resemble the stomach. And that's because they're trying to cope more with the excess acid that comes up. We call this dysplasia, but this also increases the risk of metaplasia or cancer. So if you have acid reflux symptoms, it's really important to get checked by a doctor, and if you have Barrett's esophagus, to have regular checkups thereafter. And the first test that your doctor will probably do is something called an endoscopy, where they put a camera down the esophagus, down the food pipe into the stomach. And this is going to be looking for that inflammation. It's going to see if you've got any scarring from the acid reflux. It's going to tell us if you've got a hiatus hernia. It's going to tell us if you've got that Barrett's or even cancer. We also have the capsule sponge now, which is where you swallow that capsule on the right and a sponge is released into the stomach, and then you pull it back out, and on the way out, it collects tissue and cells from your esophagus, and we can check them for Barrett's and precancerous cells. So really useful technique to avoid endoscopy in some people for screening. Your doctor might refer you for barium, where you swallow a chalky substance and then you go for an x-ray. And this can tell us if you've got a hiatus hernia, if you've got any stricturing, some scarring, or how high reflux might come up, but it doesn't diagnose GERD or reflux disease. For that, you go on to more specialist tests like a manometry. A manometry is a test where a thin tube is placed through your nose, down your food pipe into your stomach, and it's really good at measuring how weak or strong the muscles are. It can tell us if there's any problems with the muscles in the food pipe, if that valve, that lower esophageal sphincter is weak, or even if your diaphragm is weak. These things obviously predispose you to reflux. It's actually the best test as well to measure the size of your hiatus hernia. And then we get onto the tests that actually measure reflux. And we can do this in one of two ways. There's a capsule that can be essentially stapled into your food pipe to measure reflux, or you can have a catheter, a tube stuck down like Gerard is sporting here off Peep Show. If anyone's not seen that episode, it's really funny, so I recommend to go and watch it. But these tests are measuring exactly how much acid is coming up into your food pipe and whether that acid is related to your symptoms. But there's one problem with this. Not all reflux that you get is acidic. If you have a meal, for example, and you reflux after your meal, the food buffers stomach acid. So the contents that come up aren't always acidic, but they're still irritating. That's why we need a more specialist tube to measure this, called an impedance tube. And this can measure not just acid, but non-acidic reflux. It can also measure gas. It can measure inflammation, even inflammation that can't be seen in endoscopy. And it can rule out other conditions that might mimic reflux, like supragastric belching and rumination. So we consider this the best test for reflux. And why do you need to test? Well, you might not have reflux, even though you have reflux symptoms. So let's put an example here. You go for your endoscopy and it comes back normal. There's no obvious signs of reflux. Your doctor refers you then for the tests. 40% of people will have NERD. That doesn't mean you're a geek. It stands for non-erosive reflux disease. It means that, yes, you do get a lot of reflux, but you don't have any obvious inflammation. 1 in 3 people have reflux hypersensitivity. This is where you have a normal amount of reflux, but there's a good correlation to your symptoms. And this means that your esophagus is just that little bit more sensitive to reflux coming up. Around 1 in 3 people also have functional heartburn. This is where you have a normal amount of reflux, but the reflux that comes up isn't related to your symptoms. So what is causing this heartburn, this chest pain? Well, it all relates back to that gut-brain connection. And we find that people with functional heartburn who have these symptoms but don't have proven reflux on testing tend to have higher levels of stress, anxiety, depression. And then this is causing symptoms in the gut and increased sensitivity in the esophagus. And Rabia is going to show us shortly some great techniques to manage this gut-brain connection. But what if you do have reflux? What can we do about it? The first thing is lifestyle treatments. Smaller, more frequent meals. And this is because obviously large meals stretch the stomach and put pressure on that valve. So stick to around 4 or 5 smaller meals throughout the day. Don't eat right before bed. Try to leave at least 3 hours before your last meal and go into sleep. Avoid or limit fizzy drinks. Remember, every time you belch, you're bringing reflux up. Don't use straws, and that's because actually when you drink through a straw, you swallow a lot of air, and this is going to make you belch as well. Avoid or limit your trigger foods. Everyone's different. You probably know what these are. Doesn't mean you have to give them up entirely. I'm going to tell you some ways you can still eat them on occasion. You know, you're going out for a meal with family and friends and you want to indulge in those. There's some little hacks you can do, some supplements to help with that. If you're overweight or obese, it's really important to try and get to a healthy weight. And in fact, in a lot of people, this is the resolution to their reflux symptoms. Stress management, again, we know that stress can increase this brain-gut connection, increase the sensitivity in the food pipe. So managing stress can help to reduce that. And obviously, quit smoking, and this is for benefits beyond reflux, right? And here's a young MrGutHealth. And basically what I'm trying to show here is your stomach naturally curves to the left. So when you lie on your right, the stomach and its contents sit above the food pipe, above the valve, putting pressure on it, meaning reflux is more likely to occur. Whereas if you lie on your left-hand side, the stomach and its contents sit below the food pipe and the valve, and less reflux happens. And this has actually been shown in studies. If you lie on your left, you have less reflux than if you lay on your right, or even if you were lay upright. So how do you stay on your left during the night? There's a couple of tips. You can buy a maternity pillow, or you can buy one of these left-sided sleep devices which train you to sleep on your left-hand side. Diaphragmatic breathing, really, really useful tool. It's going to help to strengthen that valve, and this is what Rabia is going to teach us in about 10-15 minutes time, so make sure you stick around. But diaphragmatic breathing has been shown to strengthen that reflux barrier. It's also been shown to reduce the amount of reflux that you get. It also activates something called the parasympathetic nervous system, or what we call rest and digest mode. This is the mode that we should be in when we're eating, when we're digesting our food. But a lot of us are in sympathetic or fight and flight. So actually doing this technique is not only going to help to strengthen that reflux barrier, but get your body dialed in for digestion. And if you don't believe me, I just want to reiterate that even more. So this is a pressure meter, and pressures that are high are warmer colors like orange and red. And this means that the muscles are stronger, okay? So if we look at this, this is from a manometry in a person who is breathing normally. And I want you to focus on this. This area is the valve, and you can see the valve is pretty weak, okay? That sphincter, that diaphragm, is only about 20 to 30 points on the pressure meter. Look what happens when we start doing diaphragmatic breathing. That pressure jumps up to over 100. This diaphragmatic breathing has strengthened that valve. And it's like training a muscle in the gym. The more you strengthen that diaphragm by doing this breathing, the stronger your valve becomes, the less likely you are to have reflux in the long run. So Rabia is going to show us how to do that shortly. But another device that can help you to do that and strengthen your diaphragm is this IQ Oro. Now, it's a device that is basically placed in the mouth, you bite onto it, you pull it. It's been shown in studies to help, and it's actually approved by guidelines and available on prescription for people with reflux. Not a lot of doctors, never mind patients, know this, but I think it's only approved if you have proven reflux. In that case, you can buy this online as well. What about medications? Well, there's two main medications we use to treat reflux. PPIs like omeprazole, esomeprazole, or Nexium. And then there's the histamine 2 blockers like famotidine. And they both work on different parts of the parietal cell in the stomach that produces acid. The PPIs block the actual pump that releases acid, whereas histamine blockers bind to the receptor that signals the release of acid. All you need to know is that PPIs are stronger, but histamine blockers can be helpful for people with histamine intolerance because they also block histamine, which has been shown to make your esophagus actually more sensitive to acid. So they can work in slightly different ways, but PPIs are stronger. Now, a PPI is safe to use long term. That is the big question. One main concern people have is this increased risk of dementia, but I need to highlight that there's a lot of problems with those studies, and that's because we are an aging population. We're living longer. That means people are more likely to get dementia, and people in hospitals and care homes, when they're older, get put on these medications, and that's where the link comes in. So it's not a very strong risk and not something I would be concerned about. However, there are several things that PPIs have been shown to increase the risk of, and it's much more convincing. And that is an increased risk of nutrient deficiencies like vitamin B12 and magnesium and calcium. And that's because we need acid to absorb these. And there's an increased risk of bone fractures and osteoporosis. And that might be because actually we're not absorbing calcium as well when we're on these PPIs. And probably the strongest side effect risk factor that PPIs have is an increased risk of infections of tummy bugs, like an overgrowth of bacteria, SIBO or C. diff. And again, that's because without this acid in your stomach, any bacteria you swallow are more likely going to make their way into your gut and start to wreak havoc there. So who needs to take PPIs? There are some people that really do need these medications, and that's people with esophagitis or Barrett's, and that's because these medications outweigh the risk of Barrett's progressing into something like esophageal cancer. Also, if you have a large hiatus hernia, where the only other option really is to have surgery to correct that, then PPIs are helpful. And PPIs are needed for other conditions and other reasons. So please speak to your doctor if you are considering coming off them. How do you look after your gut microbiome if you need to stay on PPIs? Well, we know they disrupt the microbiome more than antibiotics because they're letting any bacteria that we eat make their way into the gut. So I want you to focus on the 3S, and that is fiber, especially soluble fiber from foods like oats, chia seeds, and psyllium. And that's going to help to increase levels of beneficial bacteria in your gut. Flavonoids, these are compounds found in berries, green tea, and Evo, extra virgin olive oil. These help to increase levels of beneficial bacteria whilst also reducing inflammation. And then fermented foods like kefir, kimchi, sauerkraut, these are going to introduce more beneficial bacteria into the gut. There was also a study on the Mediterranean diet in conjunction with alkaline water, which can help to balance the acidity of the stomach. In this study, they found that it was actually better than a PPI for treating throat symptoms or LPR symptoms. And they didn't look at this, but it was probably better for the gut microbiome than the PPI too. And onto probiotics. Well, these are supplements that contain live bacteria. There isn't a lot of research in reflux. There's some studies in children showing that if you take a probiotic alongside a PPI, it prevents this imbalance in bacteria, this dysbiosis. And the probiotic they used in that study was this, BioGaia, which you can buy online. It's important to note that there's no commercially available products, at least to our knowledge, that have been shown to help with reflux symptoms. Gaviscon is a really well-known product and really, really useful. I think a lot of people don't realize how it works. So Gaviscon is made from some natural compounds, so alginates from seaweed and bicarbonates, which help to neutralize the acid. But it also helps to form this barrier. So if you look in the picture, you can see this sort of white foam at the top of the stomach. It's forming a barrier to prevent reflux from coming back up. And people use Gaviscon in the wrong way. You don't wait until your symptoms occur. You need to take it before. You take it immediately after your meal and just before bed to prevent reflux from coming up. This is a product that not many people have heard of. It's from Italy and it's made from natural plant compounds, aloe vera, chamomile, and licorice, which are all really soothing to the gut. It's been shown in a randomized controlled trial to be as effective as omeprazole, but it didn't affect the gut microbiome. So this is an Italian product that you can also get online. Similarly, this is a product from Australia that you can get online, made from similar soothing plant compounds like aloe vera, slippery elm, and guar. And it's got the addition of things like curcumin, which helps to reduce inflammation. And it's been shown in a study to increase levels of beneficial bacteria in the gut and also to improve intestinal permeability or leaky gut, which is likely thanks to that glutamine, which is an amino acid that helps to strengthen the junctions in the gut lining. Intestinal adsorbents are not medications or supplements per se. They're classed as medical devices because your body doesn't absorb them. They're basically gels made from silica, and you take them and they travel all the way through your gut. And as they pass through, they're soaking up gases and toxins and removing them. And we showed in a study that they can help to reduce gas produced in the gut, which in turn can help with reflux symptoms. And I should probably mention anti-reflux surgery briefly. This is a last resort, in my opinion, for people with proven GERD and they don't want to take medications long term. The traditional treatment is something called a fundoplication, where they essentially wrap the top of your stomach around the bottom of your food pipe to form a new, stronger valve. But there are more reversible treatments available now, like the Lynx, which is a magnetic bracelet that's placed above the valve to form a new, stronger one. And Reflux Stop, which is essentially a ball that's stitched into the top of the stomach to help change the pressure gradient so that less pressure is on that valve and less reflux is likely to occur. And I just also want to highlight that at the minute, the Functional Gut Clinic, we are recruiting people with reflux for a study where you'll be randomized into one of two treatments. It's for people who are aged 18 to 70. And the other caveat is that you have reflux symptoms, but your doctor hasn't yet prescribed you any medications for these. Now, you can be taking them over the counter. For example, if you've been to the pharmacist or you've purchased some, omeprazole next to you over the counter, that's fine. But if you've been to speak to your doctor and they prescribed you the medication, you wouldn't be eligible. But you can find more information about that study on the website. So in summary, reflux or reflux disease is common, but not everyone with symptoms has acid reflux, and that's why testing is really important to identify A, if reflux is the cause of your symptoms, and B, what could actually be causing your reflux, and this can help to direct treatment. And I know it feels like you get a little bit stuck in a rut when you go to your doctor and they just want to prescribe you PPIs, but there are other ways to manage reflux. Lifestyle changes, diet, supplements, these can all be used to control reflux. And what I was trying to get at before is that, we may never be able to cure reflux, but with lifestyle changes, with diet, we can get it under control 80% of the time. And then when we want to go out for a meal with our friends and family, or we want to go, to a wedding and not worry about getting heartburn, that's when we can take these supplements, these precautions, to mitigate those symptoms. So that's the end of my talk. I'm just going to stop sharing now. We'll have some questions at the end. I'll see if I know Rabia was having some technical difficulties with her internet. We'll see how we get on, however. I'll invite Rabia to speak, and then in around 10 minutes or so, we'll have some time for questions.
Thank you, Jordan. Can you hear and see me okay?
Yes, all good.
Fantastic. And you can see my slides, yes?
Yeah.
Good evening, everyone. Thank you so much for being here with us on a Tuesday night. And Jordan, that was such a comprehensive summary of the causes of reflux, the triggers, when to see a doctor, the complications, the tests, and the basic lifestyle things we can do from diet to supplements. I feel like I learned a lot about, the full spectrum of everything from the moment we have symptoms to the point at which we're really needing help. And I'm really here to just put the icing on the cake of Jordan's talk and take this conversation a little bit deeper into some of the reasons why this reflux has developed in the first place. What is it about the way that our stomach and our food pipe works beyond the fact that our gut is this one long tube running from mouth to bottom? And Jordan has already touched on the fact that reflux is more than just acid. The stomach is both a reservoir and a pump, and it produces between 2 and 3 liters of fluid every day. These liters of fluid, funnily enough, are 99% water. And there is a small amount that is that acid, which can eventually cause the problems such as, inflammation, scarring, or as Jordan mentioned, changes in the cells of the food pipe. And I think the idea is that in order to increase your understanding of what's going on in your body, it's important to realize that this is only half the story. Half the story is the actual fluid that's moving upwards through that reflux barrier and tickling the esophagus and causing symptoms for you, which could be heartburn, indigestion, chest pain, or even belching. And all of those symptoms are essentially the echo of signals from the body. And the question is, where are those signals coming from? Yes, they're coming from the retrograde movement of the stomach contents into the food pipe, but they're also coming from your nervous system because the gut has 100 million nerve cells embedded beyond that pipe in what Jordan has mentioned, the gut-brain connection. So the gut and the brain are talking to each other in a bi-directional dialogue that's been going on since birth. And right now, as you're sat here listening intently to me, you are either in one of two positions. Either you are experiencing your symptoms or you are not. And I hope you're not experiencing your symptoms, but if you are, the chances are that those signals that your body is sending you are reaching your conscious awareness, right? You're conscious of those symptoms because the nerves in the gut are sending those signals to your brain, and your brain is sending those signals to your gut. And what I want to describe a little bit is how that is working at the moment. So I have an analogy which is appealing to some, and it's the idea that the gut is like a fire alarm, and the fire alarm is very sensitive. So, for example, when you burn toast in a toaster for breakfast, it's the smoke that triggers your fire alarm, not fire itself. And so there is a sensitive trigger in your body that is then leading to an alarm, which is the equivalent of your symptom. So the noise from the alarm is your symptoms, such as pain or a sensation of burning in the chest, for example, but it's coming from something that doesn't normally bother us. So if you're in the category of people who are sat here and you don't have symptoms, it's not because your stomach's not producing fluid. It is all of the time, but it's outside your conscious awareness. You don't have to think about your gut digesting right now. It just is doing its thing. If you're having symptoms, it's likely that those triggers are reaching your conscious awareness. And so your internal fire alarm is going off. And then when you try to silence those symptoms through medication or skipping that like burger and fries that could eat many years ago, but you can't eat now, it's sometimes is the case that because the nervous system is constantly sending signals to your gut, that it's almost like in this analogy that the off switch of the fire alarm is broken. You've done the thing to avoid the problem, but the problem is still going. And then that's when we start to sometimes get stressed and we become overwhelmed. And guess what? It leads to a vicious cycle where that then triggers those symptoms. And this is the sensitivity that Jordan was mentioning. And it relates to the idea that signals are constantly being sent from your gut to your brain. And your brain is analyzing that information. But most of the time, like right now, if you don't have symptoms, that information is kept outside your conscious awareness. When you're having symptoms, it's because you're consciously aware of those signals coming up from the food pipe. And the brain then adjusts those activities into the muscles, and the muscles then begin to behave differently. And your stomach can even produce more fluid and more acid, or you are just more sensitive to lower levels of acid because your fire alarm is going off. The most simple way to summarize this analogy is that if your body was a house, the problem is with the electrics, not the plumbing. And so it can be really disappointing if you're one of the 70% of people who have an endoscopy and it turns out to be normal. So 70% of people with reflux who have a gastroscopy done, it's normal. And you walk away from that clinic room going, but is this all in my head? I have real symptoms, but I've just been told I have a normal test. And now, armed with the information we've given you tonight, you can go, no, wait a minute, maybe I need to get a manometry test and look a little bit deeper into whether there's actual acid. But the other aspect of things you could look at is around your lifestyle and the notion of how stress can impact the gut, because it's often the forgotten protagonist in the story around reflux. And studies have shown that when we are under stress, we perceive lower levels of acid and water coming up from our stomach as more bothersome. And this is more true for the 1 in 3 people who find they just don't respond to antacid medication. So if you're in the audience and you are one of those people who've been on omeprazole, which is a proton pump inhibitor, for many months or years, and you just haven't had the response that you wanted, you're still getting breakthrough symptoms, it could be that looking at stress and putting a magnifying glass under that aspect of life is the answer to moving the compass in the right direction. Studies have also shown that sustained life stress over time predicts heartburn in the following months. And I find this fascinating because sometimes I see patients in my clinic and they say to me, well, I'm not stressed, doc. I don't feel stressed. And then I ask them, what happened a few weeks ago? What happened a few months ago? Or even a few years ago? And the nervous system of our body has memory. And the nervous system of our body, those 100 trillion nerves in the gut itself, responds to stress unfortunately, that's happened a little while ago that we haven't processed. So it's important to also remember that it's not time correlate. And if you look back to the time when your symptoms first started, can you think of a life event or something that happened around that time that could have maybe been the trigger for your symptoms? Because that could actually be a secret to unlocking the answer to the solution to solving them. And that brings me to this tongue twister, which is brain gut behavioral therapy. And I wanted to share with you that the trials have shown that there are two key therapies that work from a stress and relaxation point of view. And that can actually help reduce symptoms. The first is cognitive behavioral therapy. CBT, which many of you have heard of, is all about the way our thoughts and our behaviors end up in a vicious cycle that can promote symptoms. So, for example, you have the thought, this will make my heartburn worse. So, you're in a restaurant and you're looking at a menu and you see a tomato chicken casserole and you're like, oh my gosh, this will make my heartburn worse. And the thought is a crystallized thread in the mind. That then can lead to an emotion because thoughts generate emotions. We can feel annoyed that we can't have the one choice on the menu we want, or we feel worried about choosing that menu option. This emotion can itself, through the nervous system, lead to the symptoms that you were trying to avoid and ultimately leads to food avoidance. So we say, well, we're not going to try that dish on the menu because it will make my heartburn worse. And then there is the vicious cycle. And what CBT can do is it enters at the level of the thought and it changes the way you think about your symptoms because our thoughts are powerful. Our thoughts have real signals in the body. And the second therapy that is important is to mention is hypnotherapy. And it often carries a stigma with it because stage hypnosis, like Darren Brown, is all about controlling the mind. But actually, gut-directed hypnotherapy has been proven in research to reduce symptoms, all cause symptoms related to reflux. And what hypnotherapy is it's when you are brought into a calm state of focus so that you are more susceptible to positive suggestions. For example, the idea that you have a thought that this will make my heartburn worse, or my heartburn will never go away, or I'll always suffer from reflux. These are negative automatic thoughts we have all the time. When you're in a calm state of focus, hypnotherapy will change the way those thoughts are layered and rewire the gut-brain connection. And going to the physical anatomy of reflux and heartburn, what's incorporated into both hypnotherapy and CBT is working with the breath, working with a deep diaphragmatic breath. And as Jordan mentioned, the diaphragm is a skeletal muscle that sits at the bottom of your rib cage. I like to think of it like a parachute. So if you can imagine a parachute at the bottom of your rib cage, and the middle of that parachute is tethered to the center of the spine and also wraps around the bottom of your food pipe, your esophagus, to form that sphincter Jordan was referring to. So imagine you have this beautiful parachute sitting at the bottom of your rib cage, and the parachute moves down on the inhalation and it bellows up on the exhalation. And as that diaphragm moves with deep diaphragm breathing, it strengthens, just like your bicep strengthens when you pick up a weight at the gym and you move it back and forth. And so if we look at the normal barrier of reflux, we can see that as that diaphragm is moving, the stomach, which sits just underneath the diaphragm, is moving with motion as well. And the diaphragm is connected to the brain through the vagus nerve, which is the 10th cranial nerve running from the base of the skull down the center line of the body through the diaphragm. And it is responsible for the automatic function of our digestion, our breathing, and our heart rate. And so when we breathe slowly and when we breathe deeply, we exercise the parachute muscle of the diaphragm and we send soothing signals through the telephone line of the vagus nerve in order to change the way we perceive symptoms. And this is one of the key techniques I want to leave you with this evening, which is deep diaphragm breathing to change the way you perceive symptoms by shifting your body out of fight flight mode into rest and digest mode, and also by strengthening the reflux barrier. So, in summary, not all reflux is purely acid, and stress itself can make your esophagus more sensitive to lower levels of acid, which on a normal day would not cause you symptoms. And this happens via the gut-brain connection. Therapies such as CBT, hypnotherapy, and working with the breath can improve symptoms where medication and lifestyle factors have reached the limit of their therapeutic benefit. And so, in conclusion, managing reflux is a multimodal approach. You should be going for all of the options in a combination. So, trialing antacid medications such as the Gaviscon Advanced and omeprazole or proton pump inhibitors, if that's what's been recommended. But if that doesn't work or you don't want to be on medication lifelong, delving into these behavioral and psychological tools to manage symptoms alongside diet and supplements and probiotics, as Jordan has mentioned. So that brings me to the end of my whistle-stop tour of the gut-brain connection and everything to do with the extensive nervous system that sits within your gut and how you might empower yourself with psychological and behavioral techniques to move through your symptoms and into a brighter future. And I want to leave you for the last 5 minutes before our Q&A with guiding you through a breathwork exercise. But before I do, I just want to check in with my colleagues that I have not dropped off and that you can, perfect, thumbs up from Jordan. So I would really love to guide you through a couple of minutes of a breathwork exercise, which is intended to be a pragmatic tool for you to take away tonight and practice before meals. If you can press pause on your life for a minute or two before a meal, you will shift your nervous system into a better state to be able to rest and digest. And so, without further ado, allow yourself to relax back into your seat. And whether you're lying down, seated, or slouching on a couch, just allow yourself to gaze around the room that you are in. So begin to take in the familiar colors and shapes of the room you're in. So start to tear your eyes away from the screen. You don't need to see us, just my voice, and gaze around the room. Peripheral gaze and opening up your vision takes you from looking in a tunneled way out into a more relaxed peripheral view. So as you gaze around the room, it's the first step to calming your nervous system. And when you're ready, allow yourself to gently close your eyes or lower your gaze. And when you do, notice that your internal environment can take center stage. Your internal environment becomes more real than your external environment. And can you begin to notice the fact that we are breathing every moment of every day, and yet those signals are normally not something you have to think about? The body is so smart. And in the background of your conscious awareness, the breath is moving in and out all the time. And bring your attention to your breath now. So gently turn your attention and notice your breathing. And can you begin to notice that as you focus on your breathing, it becomes more prominent in your mind's eye? And with that breath, you can begin to take slightly deeper breaths than you were before. Ever so gently, ever so softly, start to inhale a little bit more air through the nose, part the lips, and exhale through the mouth, maybe with a little bit of sound if it feels good. Deepening the breath through the nose, parting the lips, exhale through the mouth. And with every exhalation, keep following my voice. Every exhalation, allow any tension to drain from the crown of your head to the tips of your toes. Inhaling slow and deep, parting the lips, exhaling out through an open mouth, and allowing all of the events of the day to be let go as you arrive in this very moment. And as you focus on a deeper and more fluid breath, almost like a wave moving up to shore and cascading back down with every exhale, I invite you, keeping your eyes closed, to bring the palms of your hands to the bottom of your rib cage, taking your elbows out to one side. Bring the palms of your hands to the bottom of your rib cage with your fingers pointing towards your belly button, and the thumbs can be wrapped around towards the spine at the back. So forming a C shape with the thumb and first be closed and the palms of the hands to the bottom of the rib cage. We'll just take 5 deep breaths with my count before finishing the exercise. So when you're ready, gently closing the eyes, finding that deep diaphragm breath. And inhale through the nose, fill the belly, fill the lungs, part the lips, exhale out through the mouth. Deep inhalation. Exhale out for 2, 3, 4, 5. Lovely. Inhale, deep and long. Feel the ribs expand like the gills of a fish underwater, and exhale long and slow out the mouth, feeling the belly drift back to spine. 2 more. Deep inhale through the nose, expanding out, and exhale, gently relax. Last time, deep inhalation, up and up and up and up. And this time, hold the breath at the top of the inhale with a fully expanded lungs. And part the lips, exhale out, let any tension go. And then relax your hands into your lap. And as you do so, take one last deep breath in through the nose. Exhale out and blinking the eyes open, returning to the room. So,
Well, I'm ready for my tea in 10 minutes now.
thanks for following along with me.
Yeah, no, that was really, really good. And just to reiterate, when you feel that rib cage expanding, that is your diaphragm, your diaphragmatic breathing there, and that is not just going to help to, make you feel less stressed and activate that rest and digest mode, but physiologically, it does actually make that reflux barrier much stronger. So thanks, Rabia. That was really, really super. So we've got time for about 10 minutes of questions now. What I'll probably do is scroll back up to the top to see who asked one first. So we've got a question from someone that says they're not really struggling with reflux, but they're struggling with excess gas. They work, especially at night, they're working with a nutritionist to see if there's any food intolerances, etc. But I'd mentioned some products back there, and I think you're probably relating to those intestinal adsorbents, which are essentially they're not supplements and they're not medications. They're classed as medical devices, and they work by moving, so the gels, and they move through your gut, and as they pass through the gut, they soak up things like gases. One of the most well-known one that's been used for centuries is charcoal, right? Activated charcoal. But there's now some supplements, or not supplements, medical devices like Enterus gel, which has been shown in clinical trials of irritable bowel syndrome to actually help with those symptoms. And there's some research published from our clinic that shows they help to reduce some of that gas production. So we normally recommend to have one of them just before bed, a bit like some people would do with Gaviscon for their reflux. And that can just help to settle some of that nocturnal gas. Question on Gaviscon, can it worsen constipation? Rabia, to my knowledge, I don't think it's a common side effect. No.
No, it's not something I've come across
Well,
regularly.
yeah.
So it's unlikely to.
Yeah, probably if you're struggling with constipation, then up your kiwi intake, potentially try some psyllium, laxatives if you're really struggling. There's many natural ones. So always speak to your doctor. Someone's asked a question about getting tested. They've had an endoscopy which showed gastritis, but the doctor's not recommended any further testing. I mean, each doctor's obviously got to have their way of managing things. Rabia, at what point do you typically send people for further testing, like the manometry, like the pH impedance?
Yeah, great question. So, I'm just digesting this question
Oh yeah,
to kind of answer the whole of it in the
yeah,
sense that so the question is how can I get the test needed to measure reflux and when do I do that? And then can't help further, it's my nervous system. Without further testing, my endoscopy shows gastritis, Candida, previous SIBO 2. Okay, so in answer to just echo, so I think I think what Jordan and I really want to reiterate is that sometimes when you see a doctor, like a gastroenterologist in the NHS, you will have a gastroscopy done, you will be prescribed a antacid, but you will not always get offered manometry. It's a shame, but not all centers offer it. And so, if you are someone who is curious and you've had a gastroscopy, but you've not had a manometry, this is how you measure what type of reflux you have. And the people that I would normally offer it to are those who are really heavily reliant on high doses of omeprazole or are taking Gaviscon all day, or people who, on the other end of the spectrum, don't respond at all. So if you have no response to omeprazole and you've got really bad symptoms with a normal gastroscopy, or if you are needing lots of it. Yeah. And then people who are interested in surgery often need to have a manometry before surgery. So, for example, if you say, I don't want to be reliant on medication forever, I want to consider having that stomach wrap fundoplication, we will have to do a manometry before we send you for surgery. So that is the point at which I would refer. It may, when he says it may be your nervous system, we talked a lot about that in the sense that your nervous system is always involved. And so I hope that you don't take that as it's all in my head, but you start to remember that the nervous system is always involved. So you can always work on the stress anxiety component, and you will find that your reflux changes and hopefully improves. And then you mentioned things about and SIBO, and I think Jordan's also touched on that and when to kind of get tested.
yeah. Yeah, thanks, Rabia. Next question. Someone asked, is food sitting in your stomach or you throw after you eat acid reflux as well? I mean, in my opinion, that's two, quite distinct parts, right? So if food's sitting in the stomach, it feels heavy. This might be, related to probably not reflux. Again, there's many different potential causes. That's probably worth investigating further. As with the throat as well, could potentially be related to reflux, but the sensation of things sticking or what we call dysphagia is a symptom that I think you should probably go and speak to a doctor about if you haven't already. I don't know if you would agree, Rabia.
Yeah,
Yeah.
so it's what we call a red flag. So if you
Yeah.
have pain on swallowing or difficulty swallowing, which is new for you, please see your GP as you will have an urgent referral to us.
Okay. So someone has asked about struggling to burp. Okay, so you're feeling gurgling pressure, even after things like water, and your friends refer to you as the frog. Well, it's funny you should mention that. So there is actually a condition we didn't mention because it's quite rare, but it's called RPCD or retrograde cricopharyngeal dysfunction. It's a bit of a mouthful, so it's also called abelchia, and this is where basically your esophagus has two valves, right? It has the valve at the bottom, which should prevent reflux from coming up, but it also has a valve at the top, which prevents reflux from coming into the airways. But that valve should be able to relax if there's gas in the food pipe, and this is what happens when we belch. Some people's valve at the top, the upper esophageal sphincter valve, just doesn't relax. And what we typically do is this manometry test that me and Rabia keep referring to, and we can actually objectively see if this valve is not relaxing. And then based on it, if that is present, that there are a couple potential ways of treating that, but I would probably recommend speaking to your doctor about that. You might need to probably speak to a specialist like a gastroenterologist or an ENT. But yeah, it's something we're seeing more and more of. Belcher. Um, it's a condition. Yeah. Is Gastrotus a good medication? I think, is that a bit like Gaviscon? I think it is an alginate-based medication. Have you heard of it, Rabia?
No.
No, no. I think if it's the one I'm thinking of, it's an alginate that's similar to Gaviscon, and in that sense, yeah. There's data for those alginates. It works in a similar way to Gaviscon, although we're very pro Gaviscon because we've done studies with it, and we know it definitely works. So, uh, next question: can PPIs make reflux worse, or when you stop taking it? Yeah, definitely. There's something called rebound reflux. And this happens because when you take a PPI medication, it's blocking that pump in your stomach from producing acid. And we have these hormones that work in a feedback loop. And there's a hormone called gastrin that signals your stomach to produce acid. So if your stomach is not producing acid because you're on PPIs, this hormone builds up, it builds up, it builds up. And what happens is when you suddenly stop taking that PPI, all of a sudden, this gastrin hormone is massive and it causes a massive release of acid from your stomach for a few days. So you get what's called rebound reflux. It's actually why when people try to stop the medication, they really, really struggle. But going back to Gaviscon, our clinic published some research in showing that people we can help people stop this medication. So you have to stop this medication if you're coming for testing to do a more regimented treatment of Gaviscon, where you take it 4 times per day, immediately after your meals and once before bed. And this can help you get through that rebound reflux period. Another question, a question about Mounjaro, so the weight loss GLP-1 medication and reflux. Have you seen any of this in clinic, Rabia?
So this is becoming more to the forefront of practice. I think more and more people are taking this medication. It certainly does slow gut motility. So it is something that is we're just still figuring out. I think there's definitely more research to be done around it. I do not think that there's any current research that supports its use directly for gut symptoms. But I'm certainly finding we're seeing more anecdotal evidence, like people coming forward and saying it changes the way their bowels function and
Yeah.
so on.
I
So I
think
think
I
it
was, well,
needs
I was
to
going to
be,
say, I think it's kind of like a double-edged sword in that if you're overweight or obese, this is going to
yeah,
predispose you to reflux. So it's
yeah.
going to help in that sense. But we do know, as Rabia mentioned, that these medications cause temporary issues with the way the gut works.
Mm.
It almost, causes the muscles to work in the wrong way, which predisposes you to symptoms like nausea, like cramping, like reflux. So it's a bit of a double-edged sword. Once you stop the medication, those symptoms should pass. So perhaps the benefits if you're obese for reducing down to a healthier weight is, it outweighs those side effects that you can have whilst taking the medication. Have you looked into correlation between a low acid diet and reduction of symptoms? Um, a low acid diet, I mean, typically some of the common triggers that people say affect them are acidic foods, right, Rabia? But I don't think, to my knowledge, there's studies on a low acid diet per se, unless you've seen any.
Yeah, it's a great question because obviously we hand out this advice, don't we? Stay away from citrus foods and tomatoes and chilies and things. But like Jordan said, it's around the sensitivity of the food pipe, and I think everyone responds differently. There's not studies that have specifically looked at eliminating those foods. More so, they've looked at adding in the foods of the Mediterranean diet. So
Mm.
I think following a diet that is kind of a bit more rich in good quality olive oils, fresh white meat, and vegetables and fiber and fruits. So flipping the conversation on its head, we're looking at what do we include that is perhaps more of the alkaline family, and that's been looked at in studies.
Yeah.
So I'm always encouraging for people to add stuff in rather than cut it out.
Cool, cool. We'll spend just a couple of minutes answering some questions. If we don't get to answer your question, please feel free to email admin@thefunctionalgutclinic.com and we'll follow up there, or we'll try and reply afterwards. Someone's asked a question about a 1 centimeter hiatus hernia, what they can do about it. They've had an endoscopy. PPIs only help a little bit. So a 1 centimeter hiatus hernia, yeah, it's not, it's pretty small, it's pretty common. Most healthy people will have a 1 centimeter hiatus hernia. Reflux can still occur though. I mean, the diaphragmatic breathing and potentially that IQ-ORO device have been shown in studies to help strengthen that hiatus hernia, that valve. What I would say is if symptoms do persist, then please, yeah, go back to your doctor and see if there's further testing that can be done.
Yeah, and
Yeah.
I think the thing, just to echo what Jordan said, that I think a 1 centimeter displacement of this, what it is that your stomach is displaced 1 centimeter above the diaphragm. That's what it is. And so it shows there's a weakness in the diaphragm. The stomach is displaced 1 centimeter, and we consider anything below about 3 or 4 centimeters to be a really small hernia. And so the most beneficial thing you can do is to work on your lifestyle side from what you've mentioned around the weight with diet and exercise, because the less pressure you put on the belly, the more that stomach is just going to recede that 1 centimeter back into where it's supposed to be.
Okay, I'll just answer a couple more. Someone's had an endoscopy 18 months ago, which only showed mild gastritis. They're still getting reflux symptoms. Is it worth getting another endoscopy? I mean, probably not unless your symptoms have worsened. I don't know, Rabia, at this point, if your doctor might want to refer you for more of those specialist testing, like manometry, reflux testing. From our perspective as a physiologist, if you've had an endoscopy within 2 years and it's been normal, at that point we'd probably want to do more of those specialist tests rather than repeating an endoscopy, unless some of those alarm red flag symptoms have creeped in.
Completely agree. So if your symptoms have not changed in the last 18 months, we probably wouldn't repeat an endoscopy at this point. And mild gastritis is actually, again, a symptom that, a sign on endoscopy that doesn't really correlate with your symptoms. So at this point, you haven't mentioned whether you've tried antacids or any other medication, but presumably you've tried it. I would go back to your doctor if you're still struggling, but I would mention that whether they can try a manometry test.
Cool. Does fresh milk help with heartburn? I mean, it's pretty soothing on the esophagus, so probably, yeah.
I love the question because it's just such an old school, it's like an old wives' tale, isn't it? That like you drink it's the calcium, like you drink this soothing, calcium white nectar, and it kind of lets everything. I think that's not been studied. It's definitely wives.
But right, if it works for you, by all means go for it, right? Milk's nutritious, and yeah. Okay, well, I'm going to answer one last question, and then we'll try and follow up with you all, because the next two both talk about SIBO, right? So the first question is asking, about the medications and being on them and preventing something like SIBO occurring. And then the other question is about actually getting tested for SIBO, even though they've had a normal endoscopy. Now, SIBO is one of those conditions where it does exist, but the testing for it isn't perfect. However, we know that if you're on PPIs for a long time, there's very good evidence that it can lead to an imbalance in bacteria in the gut. Especially what you get is you get a lot of bacteria from your mouth, right? Because when you swallow them and you don't have any stomach acid, they make their way into your gut. And bacteria in the mouth don't belong in the intestine. And a lot of these bacteria are fermenters. They break down carbohydrates and they produce gas. And we know from the data that if you're on PPIs for a long time, you're more likely to have this overgrowth of bacteria, especially bacteria from the mouth. which then ferment carbohydrates, they produce gas. And we're seeing that this gas produced in the intestine can actually trigger reflux events. So it's something, it's a straightforward test. Whilst it's not perfect, it can predict response, and we've published data that it's strongly linked to reflux symptoms. So probably something worth discussing with, it would probably need to be a specialist doctor like a gastroenterologist. You can always reach out to us at the Functional Gut Clinic. We provide testing, but we also provide consultations with amazing doctors such as Rabia. So yeah, I would follow up there. But I just want to thank you all for taking time out of your Tuesday evening to join us. Also, thanks to Rabia for taking time out of her busy schedule to be here. And I hope you all found it super useful. What we'll probably do is edit the recording, email it out to you in a couple of days, and perhaps even do a little bit of a guide, a 1 or 2 page summary of everything that we discussed. And then you can always message Functional Gut Clinic with any burning questions, again, pun intended, that you may have. So thanks all for joining, and we'll see you around soon.